when you want to convey post-traumatic stress disorder to the examiner, you can write, severe life-threatening injury or vicarious trauma that was severe, or severe trauma, life-threatening trauma to a family member, either witnessed or heard. Any of these points might be there to show that there was a significant trauma that was present. And then use buzzwords such as re-experiencing of trauma, in brackets, intrusive memories, nightmares, flashbacks, more than enough. Avoidance of cues or reminders of trauma. Hypervigilance, which is emotional overarousal. Cognitive aspects also need to be mentioned, and one of the words you could use there is emotional numbing. So this is how you can convey to the examiner through buzzwords very quickly that you're ruling out post-traumatic stress disorder. So let's look at the key themes that arise in trauma-related aspects, trauma-related psychiatric disorders. First, differentials of patient who has experienced trauma. Now here, of course, you'll think about PTSD, acute stress disorder, but one of the important things is post-traumatic stress disorder is almost always comorbid. The comorbidities pose the major challenges to recovery. So it's very crucial to think about the hierarchy again. Think about organic factors. Think about substance-induced, medication-induced factors, over-the-counter medication, or substance use disorders. Alcohol use disorders common, cannabis may be common. Then think about mixed states because of the possibility of limbic system activation, or prodromal psychosis, a range of things. Then affective, then think about anxiety or OCD, and then personality aspects. So what that can tell you is that by using a hierarchy, you can flash out the differentials in a person with trauma. Next, management. They've specifically asked about acute and long-term management of a patient with trauma. The key buzzword here is phase-oriented therapy. What that means is, in the short term, focus on risk management, symptom containment and management, practical strategies, problem solving, supportive counseling, sleep hygiene, short-term medication to address symptoms, but avoiding exploratory psychotherapy as it can worsen trauma-related psychiatric aspects, increased self-harm, for example, worsening of mood, worsening of sleeplessness, worsening of trauma itself, PTSD symptoms. In the long term, once the patient is well, ask the patient if they wish to engage in trauma therapy. Patient may decide not to. This is what phase-oriented therapy is. It's important in the short term to be very, very mindful of trauma exposure therapy. So do keep that aspect in mind, and that is one of the patterns to state when you come across these questions. Next, comorbid alcohol use, again pattern, dual diagnosis. Indigenous trauma, the moment indigenous trauma comes in, what I've got to think about, a few buzzwords that come in. It could be an asylum seeker as well, a refugee. Buzzwords such as cultural sensitivity, cultural awareness, very important. This is where therapeutic alliance is important, but here you're thinking about specific terms such as there may be risk of disengagement, risk of mistrust, and therefore establishing therapeutic alliance over a longitudinal period may be important. So you're flashing it out in a bit more detail. Language may come up, so use of translators. In indigenous trauma, for example, alternate belief systems may be important. Similarly, might be relevant in other cultures as well. So alternate culturally appropriate explanatory models of illness and treatments need to be taken into account. So you can see 3 or 4 buzzwords need to come in that assessment and in management as well. Next, complex trauma disorder and personality disorder overlap. Here they could give you a presentation of someone with a borderline personality type structure, and we know that there is a big overlap with complex trauma disorder. So do keep that aspect in mind. It's perfectly okay to write the diagnosis of complex trauma disorder, even if someone has PTSD, as they might have had childhood trauma and there's been a reactivation of childhood trauma due to the current trauma. So you've really got post-traumatic stress disorder symptoms on a background of complex trauma presentation.